Hi ladies, this is Aoife from Women's Health Dublin.ie. In this video I'm going to just discuss diastasis, really more in the postpartum phase and the end of pregnancy rather than people who have diastasis for many years afterwards, okay? So I suppose what I'm trying to talk about is the norm, what we expect. So those last kind of 4 or 5 weeks of pregnancy, every woman will have a diastasis. What is diastasis, I hear you say? Diastasis or diastasis recti is basically this line called linea alba that comes down to your tummy muscles. So either side of the tummy we have the rectus abdominis or our 6 or 8 pack. This is connective tissue, it's not muscle, okay? And what happens as your pregnancy bump expands, obviously, is that this starts to stretch, okay? So as it stretches and opens, this space opens wider and wider and the tummy muscles start to come to the side. So what can happen is when you try and sit up or use your tummy muscles or do something heavy to lift or get out of bed, you can get a doming around this area. So it kind of starts to stick out, okay? And so that again is considered normal at the end of pregnancy and normal in the first few weeks of pregnancy. So I should have a diastasis now, that's fine. When do we expect that to go? Probably around the 6 to 8 weeks, but it can be 3 months, 4 months, 5 months, 6 months. So when you go and see your women's health physio for your postnatal check, which we always advise you do, at 6 to 8 weeks postpartum, they will check to see if you have a diastasis. If you do, don't panic. You know, it's early days and they just might make you aware of it, give you advice about how to get the core going and to load up the tummy muscles to strengthen things a bit. You can imagine with hormones and change of exercise and all those months before, plus the physical stretching of the bump, that things are not what they were before and it's going to take time to get back to normal, okay? So again, your physio will check you and tell you if there's a gap, how wide it is, how deep it is, and give you advice about how to progress your rehab and then maybe get you back in to check and see how you're doing. So I just want to show you maybe a quick little check you can do at home, but really you should see your physio. But this is what we would do and it's completely pain-free. So you lay flat on your back, knees bent, okay? Palm of the hand will face you and we're going to check for the diastasis at different points along. So we're going to check right underneath the rib cage, above the belly button and below the belly button. Above the belly button is the most common place for it to happen and for it to be a bigger gap. So there's already a kind of a space there anyway, a gap of connective tissue. So don't worry if you have one around you or it's bigger. Again, that's kind of considered normal, okay? So we place the fingers in, we rest the head down on the ground. We're going to lift our chin up. I'm just going to move myself down a little bit. We're going to lift our chin up to our chest and we're going to see what do we feel for the gap there, okay? Oh, mine's not too bad at all. So definitely maybe a 1.5 finger gap for me. And it's really not very deep. Wow, I'm really impressed with myself. Okay, moving down closer to the belly button now. Right in the middle, fingers facing me. Lift my chin up, okay? And again, 1.5 fingers, wow. And it's really not very deep, wow. I'm only 3 weeks postpartum, that's really impressive, Aoife, go me. And I'm just gonna go below the belly button now. See that there could be a bigger gap down here because there's different way muscles are presented. So we're going to lift chin up to chest. Oh, that's really good. Okay, so about a 1 finger gap. So for me, in most of them, I have about a 1 finger gap, a little bit bigger. Depth-wise, probably half my fingernail. So some people will have a much deeper gap and they mightn't have a very wide gap, but it might be very deep. Or someone else might have a really wide gap, but it's not very deep. Or someone could have a wide gap that is very deep, okay? This is just our measurement. People get really fixated on these measurements. As physios, we're just using something as an outcome measure so that when you come back in a few weeks, we can see if things are improving. It's not our focus. What we focus on is functionally, can you lift baby? Are your tummy muscles getting stronger? You know, for you, the aesthetics, you might feel like, God, my tummy's bulging out. I hate the look of this. So again, we totally appreciate that as women, we, you know, want to get back in shape or look a certain way, so we do appreciate that. But as physios, we care more about the function. Is your back hurting? Is your pelvic floor strong? Is your tummy getting strong? Because you're doing all this lifting of baby and all the other chores that life throws at us. So again, we really care about you functionally. So what is diastasis? It's a gap of the connective tissue. Is it normal at the end of pregnancy and in the first few weeks postpartum? Yes, it is. Can it go on after that? Absolutely. We see women who are years postpartum who have one. So it's never too late to start rehabbing. You can go and see your physio. If you've checked this at home and you feel you definitely have a gap and you need help, go and see a physio for proper graded exercises. Don't just hit the gym and go and do loads of HIIT sessions. You need to kind of start off. It's not that we need to be super cautious, like don't do a sit-up and don't lift anything heavy. That's totally unrealistic, but you definitely need to grade your exercises based on your ability, and you need advice and help with that, and individual advice and help with that. In my clinic, we use an ultrasound machine to really measure so that we can, you know, again, check and have this really good reliability about how things are progressing. We also use the ultrasound machine to check which muscles are working when you're breathing and help you to cue a transverse, your pelvic floor, your obliques. So the ultrasound machine can be really helpful, but not every physio has one, and that's absolutely fine. So please go and get your postnatal check, no matter how many weeks or months postnatal you are. We won't get in trouble, we won't give out to you. Diastasis is just a part of the check, and again, it is normal to a point, but we definitely want to grade it. I am really pleased with my lack of diastasis. That is fluky. It's because I'm doing my pelvic floor. But no, again, sometimes women will just have a worse one based on their genetics, their connective tissue makeup, the size of their bump, how many pregnancies they've had, how close those pregnancies were, how active they were during their pregnancy or between pregnancies. There's loads of things that can affect it. So don't beat yourself up if you have one. A lot of the times we actually can't change that, okay? But we can rehab it and improve you going forward. There's another thing people always ask me is the linea nigra, which is a black line that kind of goes down the middle of your tummy. Sometimes you get that towards the end of pregnancy and also in the first few weeks after pregnancy. That is where the linea alba is. So it's this white line, but it kind of goes a bit darker in colour. It's just the skin gets pigmented, and it should go away after a few weeks, sometimes after a couple of months. And sometimes people with that linea nigra tend to have a diastasis. So if you see that, you might, you know, check yourself. And then an awful lot of people ask me about the belly binders or, you know, those corsets or things to kind of hold you in. I don't like using them. Look, I didn't use one. I don't have a diastasis, no, but I think you're way better off getting your muscles to do the work instead of kind of trying to bind and tape everything together. That might affect how you breathe, how your diaphragm moves. It might even, for people with a bit of a prolapse, start to push the pressure down. So I'm, look, a real purist in everything I do. I'm like, follow the rules, no shortcuts. But other people might disagree with me. I might actually put that out to some of my colleagues and see what they recommend. And maybe it varies from patient to patient. So look, I hope that was really helpful. Get your women's health physio assessment. If you think you have a diastasis, we're here to help. We can totally fix it. I'm Aoife from womenshealthdublin.ie.